Hi, I'm Dr Sonya Jessup. I'm a gynaecologist who also has done training in cosmetic gynecology, and I'm talking to you today about labiaplasty and vaginal repair. Lots of women have labia that are concerning to them because they are either asymmetrical or large, and these can prove to be daily problems in terms of wearing jeans or tight gym clothing. After many years of living with these problems, women decide that they just would like something done. Labiaplasties are a very artful operation to do. It's a matter of assessing every person's body individually and then deciding on the best way to go about treatment. Sometimes a simple trim of the labia can be what is required, but more often than not, I choose to do a wedge labiaplasty. The advantages of a wedge labiaplasty are that the external edges of the labia maintain their normal sensation. The effects are very aesthetically pleasing, and yet there's no loss of function of the labia that are there. Women are meant to have labia. It is not the goal of the procedure to take away all the labia, but rather just provide an outcome that is functionally useful and aesthetically pleasing. Sometimes there are extra little bits of tissue that need to be taken from around the opening of the vagina, and sometimes this can be combined with a vaginoplasty, which will tighten the opening to the vagina and get rid of any excess skin that may be there after having a baby. As a gynecologist, I also perform routine vaginal prolapse repairs, which are otherwise called cystocele repairs or rectocele repairs, and sometimes known as an anterior or posterior vaginal repair. These can be done by many gynecologists. As a cosmetic gynecologist, both the function and aesthetics of the outcome are equally important to me. When I perform any procedure to repair prolapse in a woman's vagina, the outcome externally is very, very important. There are many ways that these procedures can be done. I choose not to use vaginal mesh, as I believe that these can cause long-term problems in women, but using a number of buttress sutures layers with sutures that dissolve at different time frames, a very, very good outcome can be performed. At the same time, any extra skin or any irregularities can be fixed up during the procedure. Women who are thinking about having a labiaplasty are well advised to seek different opinions, but to choose somebody that will give a good functional outcome. Some labiaplasties can be fairly minor procedures and can be performed in my rooms at the gynaecology clinic using local anaesthetic. Other times I get a better result taking women to theatre when the operation is larger and when I do not wish to use local anaesthetic pre-surgery, as sometimes this can distort the tissue and not give a good feel for what you're going to get as a final outcome. It does take some weeks for a labiaplasty to heal properly. There can be some bruising or swelling, and occasionally there will need to be a little minor adjustment performed after the surgery that can be fixed up easily in the rooms. Having a repair of the labia these days is very, very common, and each woman's circumstance is completely different. So a full assessment is necessary to make sure that there are no functional problems that also need to be addressed, and that there's no infection that will interfere with the healing process. So if you're considering a labiaplasty, make sure that you see somebody that has lots of experience in the area and that can give you a good outcome.